This is an example for showing how the retinal imaging helps in making a diagnosis and hence better planning of treatment. The image on your right side that you can see is a red-free image of a patient who presented with a blurring of vision. This patient is known diabetic. You can see this optic disc here, and this area represents the cross section through which the macular scan is performed. When you look at this image, you can obviously see some dark area here. Because it is red free image, you can see it is a dark area. This is basically the blood. This is a pre-retinal hemorrhage. How do we say it is a pre-retinal hemorrhage? Because we are not able to see the underlying retina here. If you are able to see the retinal blood vessels and there is a bleed, then that will be a subretinal hemorrhage. From where do we get this bleed or the pre-retinal hemorrhage? This is from the new blood vessels, that is the neovascularization. You can see probably some possible neovascularization here. Now once there is a pre-retinal hemorrhage, we are not able to see the underlying retina, so we don't know what is the status of the macula beneath the pre-retinal hemorrhage. The image on your left side is the OCT scan through the macula. The black area here, that all represents the vitreous, and this line is your internal limiting membrane, and the structures below it are all the retinal layers. If you look at this, between the vitreous and the inner limiting membrane of the retina, there is some hyperreflectivity. This is your pre-retinal hemorrhage. With our eye, we will not be able to see the retina below the pre-retinal hemorrhage. But when you look at this cross section, you can obviously see there is a lot of retinal thickening or the edema. The retinal layers are all showing a lot of intraretinal fluid and retinal thickening. These hyperreflective areas represent the exudates in the macular area. So this image shows gross diabetic macular edema in a patient who has got pre-retinal hemorrhage. So this image clearly shows how the retinal imaging helps in management of the patients. If we did not have an OCT scan, probably we would have decided to just do the pan-retinal photocoagulation for pre-retinal hemorrhage, because pre-retinal hemorrhage is the one of the manifestation of proliferative diabetic retinopathy. But because there is an associated diabetic macular edema, it is important to treat it as well to decrease the risk of losing vision. The treatment for diabetic macular edema may be in the form of anti-VEGF treatment, which may be like ranibizumab or bevacizumab or aflibercept injections.